right, this is the first of 9 Fee Talks today, Family Engagement and Empowerment, and I have the honor of introducing Holly McPhail, parent and Whole Child Leon board member.
Hi, good morning, and thank you for allowing me to join you today. It's my honor to be here as a parent representative and a board member for Whole Child Leon. But before I continue, I just want to give a quick shout out to our founding member, Representative Loran Osley. She has been not only a personal mentor, but a founding member of this philosophy that I get to tell you a little bit about, a little more about why we do what we do, and invite you to connect with us if you have not already done so. Now, our organization is comprised of a governing board and 2 staff members. We represent a cross-section of Leon County residents. It includes educators, medical providers, business owners, members of the faith-based community, and parent and child advocates like myself. But we are not a direct service provider. Rather, we are a community-wide effort to ensure that all children have the best possible start in life and that they have everything that they need to thrive and arrive at kindergarten ready to learn. Now, we work with a variety of groups, some existing groups and some groups that we start ourselves, and it's to reinforce the idea that communities that invest early are the communities that have the healthiest outcomes. Now, I believe that everyone here in this room knows that the first 5 years of life are the most important for the development of a child. Study after study reinforces what the Family First Initiative is all about. And that is that these early years are critical for a child to acquire the social, emotional, and cognitive skills that are needed and necessary to lay a foundation for success later in life. Now, studies show us, and this is some of the great work that has come out of the Center for the Developing Child at Harvard University, that the first 5 years is when brain development is at its most rapid process, more so than any other time in their life. In fact, 90% of the physical brain structure of our children is set in place by age 3. These same studies also show us that during this time period, there is one thing that has an exemplary effect on the developing brain, and that is the quality of adult-child interaction, parent-child interaction. Now, I would impress upon you that it doesn't start at birth, but it starts before birth. And let me demonstrate this. I'm going to invite Courtney Atkins and Marie Bryant to come up on the stage. And as they do, I want you to imagine these 2 ladies are babies in utero, right? These 2 individuals, they're babies in utero, and this is that time period when all of those attachments and how they process information and the brain is beginning to, this is when it's starting to form. Now, I will say before we start that genetic code does in fact provide a blueprint for our brain structure and developing those circuits. But it is the quality of the interactions and our experiences that will reinforce the positive, healthy circuits that lead to healthy attachment and positive social emotional well-being later in life. Okay. Meet Marie. Her mother and father want this child, and they have access to affordable, high-quality prenatal care. Take one step forward. Meet Courtney. All right. Her mother is unmarried. The pregnancy is unplanned. She's not sure that she wants to meet the baby. Have the baby. Marie's family has a steady income, owns their own home, and a strong network of friends. Take 2 steps forward. Courtney's mother lives in a shared apartment. She waits tables, and she's wondering how is she going to afford all of these things for her child. Hey, but at least she has a job, so take 1 step forward. Now, Marie's mother is taking folic acid, has regular checkups, and she feels very supported by Marie's father. Take 2 steps forward. Courtney's mother loses her job at the restaurant she was working at. She gets into a fight with her boyfriend. He's yelling at her a lot and pressuring her to terminate. It's the final trimester. Marie's mom is ready. She's thinking about breastfeeding, natural versus epidural. She's talking about diapering. She's talking about childcare. Take one step forward. Courtney's mom is not ready. She's thinking about how to pay her bills. She's thinking about her own childhood. She's reflecting upon her own relationship that she had with her mother. She's wondering if she made the right choice to keep the baby. Fast forward to delivery day, both babies arrive. Marie gets to go home and has a safe place to sleep next to her parents' bed and not in it. And her mom is rocking at breastfeeding. Take 2 steps forward. Courtney goes home, and fortunately, she does have a safe place to sleep because a charity has donated a pack and play to her, and they're trying to breastfeed, so take 1 step forward. But Courtney's having a difficult time latching on, and both mom and babe are frustrated. Fast forward 3 months. Marie is read to daily, and she's starting at an Apple-accredited preschool. Take 1 step forward. Courtney has a variety of inconsistent caregivers because her mom is out working any shift that she can find, relying on friends and family. She doesn't even know what Apple accreditation means. Fast forward 6 months. Marie is thriving. Her parents take her for a walk in their neighborhood, and according to her pediatrician, she is meeting every milestone. Take 2 steps forward. Courtney, at 9 months of age, has learned that when she cries, her mother gets yelled at. They want to go outside, but they can't because there's no sidewalks in their neighborhood, and safety is a real concern. And when Courtney gets sick with a case of the sniffles or a fever, her mom takes her to the ER because they don't have a pediatrician. You guys see the gap. You see where I'm going. These 2 individuals are not even 1 year old. Now, I want you to imagine how big this gap will be if we wait to intervene when they enter kindergarten. Thank you, ladies. Now, studies consistently show that it is about 25% of all children that are arriving at preschool without the necessary skills to be prepared to learn. And Leon County is no different. When we look at the data from Title I schools alone, it shows us that those children are twice as likely to not demonstrate the needed skills. We know that this gap, according to the research, is based on those factors that we just demonstrated: access to health care, whether it's prenatal or postnatal, safe and nurturing environments, neighborhood and household conditions really do matter, safe and positive social emotional attachment with a caregiver, participation in a high-quality early learning facility environment, and economic stability. Now, we all know the difference between a Title I school and a non-Title I school, right? Poverty. Leon County is no different. 1 in 6 families that have a child under the age of 18 live in poverty. That equates to more than 4,000 preschoolers right now. That number is even higher when we consider those families that are asset limited, income constrained, but working, like Courtney's mom in our example. We also know that those children who arrive at school unprepared to learn are 25% more likely not to finish school, to drop out. We know that they're 40% more likely to end up as teen parents and 60% more likely not to go to college. The evidence is clear. What happens in early childhood development in the first 5 years matter. It lays the foundation and sets the course for lifelong learning and healthy social emotional well-being. So the question is, what can be done? We intervene early, and when we intervene, we focus our efforts on building relationships. Building strong relationships within the families that we serve, with the families that we serve, and with each other. And we meet families where they're at, right? We meet them where they're at, we identify what needs to be done, and then we do it, and we stop making excuses, that our agency doesn't let us, or there's a barrier here, we need to break down the barriers that our organizations and our institutions and our funders put into place that prevent us from doing the real work to impact the whole family. And that's why Whole Child Leon exists. As I said before, we are not a direct service provider. Rather, we are a catalyst for change, a convener of the partners to get things done, and a connector of families to services and provider to provider. Now, our organization believes that the vitality of this community are dependent upon healthy birth outcomes, economic stability for all families, safe and nurturing environments, and equipping the children in our community with the social and emotional skills that are necessary to arrive at kindergarten prepared to learn and ready to succeed. We have developed a series of, we collect data on all of these critical indicators, and we put all of that information and we develop an action plan and pull the right partners in together to work together. We publish it in our Status of the Child report, and we commit to you that we will continue to publish this report card of our community and engage in the crucial advocacy work that we are doing until those trend lines that we shared earlier change. But we cannot do it alone. No single agency is able to truly see, understand, and impact that whole picture of health. And as Mayor Gillum said earlier, it takes our entire community working together. It truly takes a village. And as a parent and a member of Whole Child, I have learned that firsthand. I want to thank you for your time this morning and invite our Executive Director, Courtney Atkins, to come up, whom without leading a lot of these efforts, we would not be as successful as we are. She's going to talk to you more about the Status of the Child report and highlight some of our key initiatives that we are doing in the community that we hope that if you're not already a part of, you'll get engaged. Thank you.
Thank you, Holly. Awesome, right? Yeah, so I'm going to talk a little bit about some of our initiatives, why we do them. Many of you are our partners, but just to give you a little bit of an idea about Whole Child, and if you're not already connected with us, you can do so. The purpose of this Status of the Child report is really to highlight those key indicators, as Holly mentioned, on the condition of children birth to age 5. We select critical indicators that are related to child well-being, and we solicited feedback from many of you in the room in the process. By collecting and reporting this data, it allows us to have those trend lines, know where we're going, and see if we are moving the needle in a positive direction on child well-being. We use the report as a critical advocacy tool as well to raise visibility of children's issues and to do this through a nonpartisan and evidence-based lens. By tracking these key indicators, it helps inform us if we're moving in the positive direction we need to improve conditions for children in Leon County. Maternal child health, it's near and dear to our heart. If we're to ensure that children are healthy at age 1, women need access to prenatal care and access to resources to support a healthy pregnancy. Whole Child has partnered with the Maternal Child Health Equity Collaborative for the last 3 years. This collaborative focuses on promoting health equity and reducing disparities in health and healthcare in diverse communities, including Black infant mortality rates. Breastfeeding, we know, is important to the health of the mother and the baby. It doesn't just benefit the baby, it extends well beyond just nutrition. Our breastfeeding rates are too low. As a member of the Breastfeeding Policy Work Group, we're working to increase the number and duration of women breastfeeding in our community, especially among African American women. The Breastfeeding Policy Work Group is working to ensure that workplaces have policies in place to support breastfeeding mothers. Childhood obesity prevention education. Whole Child wants every child to enter school at a healthy weight. Since 2011, we've worked to engage all sectors of our community in the obesity crisis in Leon County. We created 95210, the Whole Picture of Health initiative. It's a community-wide strategy for promoting child health and well-being and lifelong health habits among our young citizens. We've implemented 95210 in early learning centers, elementary schools, pediatrician and family practices offices, and even in businesses. The simple health message behind each number communicates a health behavior to promote healthy weight and overall good health habits. We're a proud partner of the Early Childhood Obesity Work Group. This is led by the FSU College of Medicine to address issues related to childhood nutrition. This community coalition consists of parents, physicians, community organizers. It's focused on intervention initiatives to get young children at a healthy weight that are at risk for obesity. Neighborhood equity. Place really does matter. Areas of our community face disproportionate health risks. Zip codes really can be predictors of health and well-being in this community. Environmental, economic, and social factors cause these risks. Lack of trust between residents and government can worsen them. In 2014, as a response to the blight in the South City neighborhood, Whole Child Leon founded the South City Revitalization Council. The council's primary goal was to serve as a change agent to improve the mental, physical, social, emotional health of South City. Since that time, the council has worked to engage residents to have a voice in their community to improve conditions in their neighborhood. We've engaged the residents to organize a neighborhood association. We've helped facilitate organizational development and capacity, starting a sports club for youth, a community garden, and a children's library. We've also collected data to help support decision-making by conducting a door-to-door neighborhood health assessment in South City, the first of its kind in Leon County. Many of you know about this initiative. We've been working on screening children since 2009. Many of you in the room are key partners and help make this possible. We want to ensure that children are screened early, often, that developmental delays are identified, and that children are connected to interventions, appropriate interventions, before entering school. Whole Child Leon and the Capital Area Infant Mental Health Association came together to coordinate free developmental screenings in our community back in 2009. The collaboration is 26 partner agencies, more than 100 volunteers. The children are screened for vision, dental, social and emotional development, and then connected on-site the very day to the providers that are appropriate for any interventions they may need. This twice annual screenings are free, and they're for the entire community. Since 2009, the group has successfully screened more than 800 children. That may not sound like a lot, but these screenings are so comprehensive, it takes more than an hour and a half for a child to get through every single phase. The Professional Network and Community Conversation is a meeting that many of you all attend. We organize this monthly. It's a forum for professionals just like you from agencies and organizations providing services to children to make contacts and share ideas. The meeting helps promote community partnerships. Whole Child Leon and the PACT Early Childhood System of Care came together to ensure that issues concerning children and families were raised in these meetings. We identify strategies to address the gaps and needs that are identified from our speakers and from our conversations. If you're not already attending this meeting, I really encourage you to join us and get involved. In closing, I want to tell you about an African tribe called the Maasai. One of the most accomplished and fabled tribes of Africa are the Maasai. No tribe was considered to have more fearsome warriors and more intelligent warriors. The traditional greeting that passes between Maasai warriors is Kaserian Injera. This translates, and how are the children? This traditional greeting among the Maasai acknowledges the high value they place on their child's well-being. Even warriors with no children of their own always give the traditional response, all the children are well, meaning that peace and safety prevail, life is good. Their priorities for protecting young children are in place. The Maasai society has not forgotten its reason for being, its proper function and responsibilities. All the children are well. It means that life is good. It means that daily struggles for existence do not preclude proper caring of our young children. I often wonder how it might affect our awareness of our own child's welfare if we began greeting each other with, and how are the children? I wonder if we heard that question and passed it along to each other a dozen times a day, if it would begin to make a difference in the reality of how children are thought of or cared about in our country. I wonder what it would be like if every young adult among us, every parent or non-parent, felt an equal weight for the daily care and protection of all our children in our community, in our state, in our country. I wonder if we could truly say without any hesitation, the children are well, the children are well. What would it be like? I wonder. Thank you.